administrative side or from the government side or even from the NGO side, whenever the management aspect comes, they are just bothered about the reconstruction and rehabilitation, but nobody bothers about the psychological rehabilitation. So in this backdrop, this article, particular talk is planned, like how disaster can affect mental health and how it can be managed in a better way. So I'm just skipping through a few slides. Already you must have seen all these slides, like how the disaster can happen and all, like hurricane, tornado, flood, and earthquakes or explosion, hazardous materials accident like Bhopal tragedies and all, where and recently even in Andhra it happened. Then the right now we are facing like a few months back, it could be warfare between countries or between continents, famine or even epidemics like corona is one of the best example where you can quote from. And what exactly happens with a disaster? So basically, a disaster causes human suffering. I am talking from more from what you call psychological side, human psychological aspects where it is affected more. Then it requires what you call a lot of what you call collective work from many people. Then to reduce the effects, to rejuvenate or rehabilitate, we require a lot of assistance and we require a lot of psychological support to get back to the normalcy. So we have when you talk about the traumatic events, because all this can bring what you call trauma in the person. Trauma is like what you call a long-term shock, where a natural disaster like an earthquake, and you are losing everything, and it can bring a trauma. Technological disasters. I think I was just able to what you call talk to listen to Dept sir's talk. He was talking about how the what you call food and health and disaster can this one. Yes, technological disasters can be very a lot, and disasters of human intention. Today, if you are seeing what you call the warfare and all, it's more than what you call on the ego side rather than what you call nobody's going to win. But disasters can be a long term, because now if you see Gaza Strip and all, imagine the things which have happened there, where it requires at least more than 50 to 100 years to reconstruct. But yes, the physical aspect you can rebuild. But what happened to those what you call poor children who lost their lives, who lost their parents, or parents who lost their children, and imagine the severity of it. Then interpersonal violence as well as a sudden traumatic loss, where it can be bush, this one fire and accident, where you sometimes you are not at all responsible for that, but others are responsible for that. All this can bring trauma in the person. And suppose what you call come to India scenario quickly. This one, India is one of the most disaster prone in the world, because our land area 65% is affected. Then 70% of land under cultivation. That's why sometimes we get drought and all. Then 40 million hectares to floods and 8% of land to cyclones. And the statistics says that every 2 to 3 years there is a major disaster happening in one or other places of our country. And India is such a big, huge country, so we require a lot of what you call planning for that. Then 50 million people, see that's a big number, who are affected annually, and more than 1 million houses are damaged. Now this is again a big number, and what to call the damage is quite a huge that we cannot imagine the amount. They estimated up to 70 million US dollars. Once you convert into what you call rupees nowadays, it will be 87 rupees into 70. That much of millions of the millions of rupees. Now imagine the what you call the damage which is happening because of that. Then what are the major disasters affecting India? Now, this is what you call where you are going to talk about how India is what you call prone to various types of disasters. One is earthquake, and then the volcanic eruption, then tsunami. We experienced not very recently, but way back we have experienced this. Cyclones are happening right now. Floods are happening. Landslides are recent landslide. You can see in what you call Wayanad, or much before that in Coorg and other areas. Bushfires are not much. Drought is very common. Then accidents like railway accidents are happening, and somebody's fault, somebody will be suffering. Then civil unrest is what you call another part, where because of the civil unrest, where it could be religious unrest, it could be what you call a inter what you call a state. For example, not to bring anything personal now here. Now remember recently what's happening, because there is a fight between Karnataka and Maharashtra. So if it goes in a bigger way, so it becomes civil unrest. Then COVID-19 was the best example where all of them have suffered. Uh, then one of the major thing is whenever what I call a disaster happens of any kind, first thing is it brings a stress. Okay, so during this stress part, what are the things can happen? Now there could be emotional issues, there could be cognitive issues, there could be behavioral changes and physiological experience of individuals. Because sometimes what happens, mind affects the body. Because nowadays you know how our thinking can affect our body, and there could be a lot of psychosomatic disorders. Then this can happen to those who are individuals who are directly what you call experiencing the disaster, or those who have seen it, or it can happen that their coping and problem solving abilities can be at risk. So this is where stress can be a major aspect. And whenever there is a survivor what you call from the any disaster, what are could be their reactions? Now a survivor's reaction will result from an interaction between the characteristics of the disaster, the individual, and the response. Because, for example, when you talk about the disaster characteristics, how serious it was, like whether it is a very severe one, or it's at a moderate level, or it can be at a tolerate level. So, disaster characteristics itself can determine survivor reaction. For example, when an earthquake, like somewhat people think to manage, but remember tsunami and all. Earthquake in a major earthquake, yes. Now the characteristics would be very different. Then when it comes to the individual characteristics, now basically this is like the stress tolerance, how a person is going to manage the disaster. So now this depends upon how the individual's stress tolerance capacity, how the person is going to manage it, because this usually happens. Some people will take a bigger stress in what you call very normal level. For other people, even a small stress can be taken as a bigger level. So it depends upon the individual characteristics. Then there could be response characteristics, how the person has reacted to a situation. So all these will be predictors of survivor reactions. Now, when I said about disasters, what are the characteristics? One is the size, how big or how intense it is. That's more important. How long it cost. That is more important. Size of this one, what you call the intensity of it, the time duration of it. If it is happening continuously in a bigger way, imagine what can happen to a person. Like repeated earthquakes happening in a place, repeated droughts are happening, and for a longer time, and it can affect a lot. Then what is the reason or cause behind this? Whether it's naturally happening because of the ecosystem, or because of natural systems, or it's a human made. Because nowadays we say whatever the Wayanad, recently what happened in Wayanad and the landslides, or few years back happened in Coorg and all. It's now we blame it on the human side, because human beings are responsible for this kind of disasters. Then sometimes you have got a warnings, early warnings, like no, okay, please vacate the place. Then okay, evacuate the place, so that you'll be knowing, and you'll be expected disasters like from the meteorological department or any other department might give you a what you call warning, better you leave the place. Or sometimes it happens without any expectations, then the severity could be much more. And again, it important what timing is happening. Is it happening on the daytime? Is it happening in the what you call evenings, or in the nights, or whether it's happening in the weekends, or whether it's restricted to any seasonal variations? So now all this will have influence on our mental health. So who are at more risk? Suppose now slowly coming to the psychology part of it, disasters impact risk factors. Anyway, I'm not going to much talk about the infrastructure part. I'm moving into more of psychological part, where these disasters can affect whom. So we call them as vulnerable populations. Now, what who are those what you call vulnerable populations, and we can put categorize under them. First group itself is the children, because they're not exposed to any of the what you call this severity of the things, and suddenly something happens. Definitely, what you call things can change in a what you call in a bad way for them, and Now we refer to childhood trauma. Now, whenever we talk about childhood trauma, remember that can long last even during their adult stage, even up to their elderly stage. So the childhood trauma can have a lot of impact in the future development. Then the second group would be what you call the elderly, the aged ones. Usually we say elderly means above 60 years, especially who are weak, so like because of their life experiences. When they think that they are what you call psychologically weak to face the situation, and the effect could be more on them. Then people with the serious mental illnesses, because nowadays we have several mental illnesses affecting individuals, and psychiatric associations have got what you call problem with the classifying them. So those individuals with the mental illness can perceive these disasters in different way, and the severity could be much higher. Number 66, Ravindra Dala, please, can you mute yourself? Okay, then people with the physical disabilities. Why this group is vulnerable? Because these people cannot plan it fast, and if something is happening sudden, there's no way to escape from the disaster, and these people with the physical disabilities are highly vulnerable to this. Then people with the substance dependency like alcohol or other drugs. Now they also having this one come under vulnerable populations. Why? Because under drugged conditions, their orientations would vary. Once their orientation would vary, they'll not be knowing what is happening to them. And by the time the disaster overs, the damage could be much bigger than what is expected. Then there's a people living in poverty, because poverty also having what you call leading to its own contribution, because people living in the poverty can't make plans immediately to do some of the immediate what you call reactions to the disaster. And this group also what you call highly vulnerable to the what you call disaster, and the effect could be more on them. Then suppose coming to the what you call the consequence of disasters. Now physical, I don't know, but mental health more important. Various forms of stress are very common in what you call disasters. Okay, now as I said in the beginning, nobody measures what are the mental health injuries compared to physical injuries. Yes, physical injuries everybody okay estimates this many crores of rupees lost, this one lives lost, everything comes with the numbers and the estimation. But when it comes to mental health injuries, now that estimation is what you call not very accurate, or many times there is no estimation at all. Then mental health of community before disaster will determine how resilient after disaster, because uh, the idea here is before disaster how it was called this one how was the mental health. Now this is how they are ready to face back, or resilient is nothing but bouncing back to the situation. But if they have got a strong mental health, if the community has got a strong mental health, and they have idea of bouncing back to the normal, then it can come earlier, or the psychological rehabilitation could be much faster. But if the mental health of the community is weak, then and the resilience also is weak, then the problem is they may suffer more. Then disaster mental services, especially because we talk about only few other services, they are what you call vital components of planning and response. Because as I said, psychological rehabilitation, psychological first aid, post recovery phase, that is also more important. Because sometimes what happens is the trauma is so much that the person is what you call might never sleep. The trauma is so much, the trauma has just happened in person, the person has witnessed it, or even he could be a part of it. Now this can bring a lot of trauma. So for such people, a planning could be required, and we have to change their responses by various types of therapies. So that's the idea here. uh, what happens on a cognitive level? Now, slowly, let's get into the micro level of such things. So, typical disaster response system, especially when it comes to cognitive, basically, here cognition refers to the our thinking and other related aspects. The first and foremost thing is our distraction, because the person is not able to concentrate. That is a problem, because the attention part is very less, because all the time the brain is thinking about what you call the disaster part, the loss part of it. Because of remember it's not just mental health, it's because of the loss of things, and it can have a lot of impact on the what you call person. So distractibility, and this whenever the distractibility is there, there could be what you call high recurrence of what you call this one. The person might lose attention, and there could be high irritability with these persons. So one of the major part is distractibility. Then the next part is what you call how they think about the duration part of it, what happened to them, and the distortion. They want to forget what you call. They want to ignore a few of the things, though it has happened just in front of them. They might think that this has not happened. So this also can happen with us also in a normal situation. Whenever some what you call dear and near ones have died, so the first few days we think that the person is not dead. The same response might come here also. So we might distort the original thing on a psychological basis. Then there could be decline in the work performance, because when the person is what you call the attention and the thinking is distracted, the person is attention is lost, the person lose concentration over his work. Once the concentration is lost on the work, there could be what you call loss of what you call interest in the work, and this might affect the work performance. Then recurrent what you call intrusive recollections. The person might what you call get all those thoughts back again and again. So this the when this trauma part and that scene, whatever the person has seen or inward, might again come back again and again. Now this can bring lot of what you call irritability in the person. Person may not be able to what you call stand or sit at a place. The person might act like insane. Then as I said, flashbacks and the nightmares, even the person is not able to sleep in the night, and there could be a lot of recurrent ideas of things, and person thinks more about it. So that's the idea there. So cognitive level there could be more issues. And what happens on a behavioral level, these are the effects. Okay, clinging, because this is what happens. You must have seen, especially I'm giving an example of a child. Whenever the child sees something threatful, the child just comes and what you call clings on to the mother or the very close ones. Now why? Because the child is not able to what you call manage that situation. Now same thing happens with the elders, or with the what you call not only child, with the others who have seen or experienced what you call are part of the disaster. They might to cling to someone, they might be, may not be on move to another place, or another thing is they could be what you call just isolated. So this is where what you call the isolation part, where they could be completely isolated, thinking only on that. Surprisingly, what you call there could be thrill-seeking behaviors. Sometimes what happens, there could be weather forecast, and the weather forecast says, or what you call, yes, you should not go near the sea. There could be what you call high rays are coming and may hit the shore. So don't go what you call near the shore. But you have seen how our youngsters, they're going even in the high tides. They want to have a thrill-seeking behavior, but this could be what you call dangerous to their lives itself. But this is a behavioral response. Then sometimes reenactment of the trauma, like repetition of the same thing is happening behaviorally. This leads to increased substance abuse, because the person has lost so many things. Person has lost properties. Person has lost lives. Person has lost near and dear ones. The person wants to forget. The person wants to forget all these things. So now one of the ways the person is not a what you call uh, positive coping. It's basically what you call it's not a good coping technique. The person might get into alcohol use or substance abuse, or get into what you call smoking and other habits, which the person thinks that by getting into alcoholism or by other using other drugs, person might get out of that. But please remember, all these are all temporary what you call remedies, and they have got their own impact on the health. In the long run, these are not going to be useful. In a way, the person is going to lose lot of his physical health. And again, as I said, mind body and body mind relationship. So when the body's mind is affected, body is affected. When the body is affected, also mind is affected. So there could be a doubling of the issues. When both the healths are upset, imagine what can happen. Then hypervigilance for small things. Now hypervigilance here refers to how the person reacts. For small things, the person is overreactive. So once the person is overreactive, it is not good because the adrenaline rush is more. Where the usual way of reaction will be not there, there will be unusual way of reaction, and it's more of what you call a reaction, which is what you call in action. The person will not withdraw. So that's why it's called as hypervigilance, where the person is more what you call cautious, and this more cautious can have its own impact on the health. Then elevated startle reflex. This is again what you call the person, because of his so much vigilant for small things, he is mentally getting prepared. And as I said, there could be too much of adrenaline rush, and we know that too much of adrenaline, what you call pumping in the body, is not good because the person is always, if it's a tense situation, now we refer it as a type 1 personality, who are more prone to what you call heart diseases or heart issues and other related what you call bodily symptoms. Now this is where even in the what you call response patterns usually we find, but this can have further more consequences. Then comes physical what you call disaster response patterns. One is the shock symptoms, where there's a first level where what you call the shock symptoms will be what you call seen. The person gets lost. Okay, like no psychologically, person looks totally dumbstruck, or having no this one. He thinks like like no. There's a shock where you are dumbstruck. Then insomnia. There's nothing but a lack of sleep, because the person is not able to get a good sleep. Why? Because the person is what you call thinking of what you call psychological as well as uh, property loss and other things. Now this might bring what you call lack of sleep or insomnia. Then loss of appetite. Now this is where the person might try to what you call eat, but he may not able to eat well. Why? Because the person is thinking too much. But remember, this has got another consequence, what you call loss of appetite. Usually uh, the person thinks that he has lost the appetite, but actually the system needs some food. Your body really requires some food, some carbohydrates from proteins and all required. And our system is in such a way that is conditioned to what you call secrete the digestive juice or digestive acid. So usually it will be morning breakfast, afternoon lunch and evening dinner. So all the time the digestive acid will be secreted during specific time. And when there's a loss of appetite, though you are not eating or the person who is suffering is not eating, but digestive acid will be secreted. So it can end up with a few of the other aspects like what you call ulcer, peptic ulcer, or even what you call gastritis if you don't eat on time. Then muscle weakness, because all these are related issues. uh, when you talk about muscle weakness, the person thinks that he has lost the energy. Earlier he used to walk for 5 to 6 kilometers without any problem. Now by walking 1 kilometer only, the person thinks he's tired and he may not move further. A lot of other things, he cannot do the work properly, cannot lift or this one. So muscle weakness also could be another factor. Then elevated vital signs. Now when you talk about vitals, basically your blood pressure, SBP or systolic or diastolic pressure, or even respiratory rate, or all the hemodynamics like pulse and all. So there could be increased one, which is again affects our body back. So all these things will be seeing on a physical level. Then affective level, where when we talk about the affective level, now which is not seen, now it's the feeling part of it. Now we thought of one which cognitive, we thought of it. That is what you call cognitive part. Now it's the affective part. Now one thing is basically person what you call the typical response pattern when a person has witnessed or is a part of the disaster what you call happened. The first thing is two of the psychological issues, depression and anxiety. Okay, depression basically the person loses hope over the future, and you know that extreme depression or severe depression might end up in suicidal tendency and further suicide. Next is typically anxiety, where the person anxiety is basically here what you call apprehension of threat, like what next, because we have lost so many things. We have lost physical infrastructure, we have lost near and dear ones. Now what next? That anxiety, what is the future part of it? Now this also can happen. Then there could be numbness. The person might what you call Person what you call might restrict his movements, and person might feel numbness of what you call hands or this one, where they're not able to move, though the scan will tell nothing, but that numbness can happen. Then constricted effect, the person will not what you call react too much. Raghavendra AM, mute yourself, please. Okay. So constricted effect is like the person is not going to react much, a kind of what you call again connected to numbness. Then there could be guilt, shame, and fear. This is also important because guilt because you are not able to do anything because the disaster has happened. Shame because you are not able to manage well, and fear because the loss of things, fear how to answer. Then intolerance of fear response also one of the important thing, like what you call these are happening. Okay, intolerance of fear responses. Then global pessimism is another feeling part. Okay, and see nowadays what we get so a few of the what you call the recent thing what we have seen is African continent a part is moving towards India, and it's going to hit the Western Ghats. I don't know how many of you have seen that in the TV, where a part of Africa is going to be separated from Africa and is going to move through and it's going to hit the Western Ghats. And there could be what you call creation of new Ghats and all. Now this can affect what you call it's going to be a disaster anyway. Now what we think, okay, especially people who are in that area, what's going to happen to them? So now it is like on a global level, and it's not optimism, it's a pessimism. And remember, you must have all thought of like it's happened once when the COVID-19 came. Imagine what was the global pessimism. Like not many people are going to survive. Just 1 or 2 months back, again one more news came. Like again, what you call COVID variant has come, but by chance nothing happened. So now this is called as global pessimism, where we look very negative towards the future. And if the entire world looks at negative towards the future, imagine what all the things can happen. So these are the affective level reactions. Then grief, psychological aspect is one is a grief. We what you call when you talk about grief, it is a natural reaction to loss. So it's a physical life or a physical property or what you call death of near and or loss of near and dear ones. No, it's a natural reaction to loss. And grief will not what you call survive longer. It will last only what you call for a few days or few weeks, because prolonged grief, if you think of that, that prolonged grief leads to depression. So many times there is a confusion between what you call uh, grief and the depression, and many times the psychiatrists have confused grief with the depression and have given the depression medication. But remember, grief plays an important role in understanding trauma, because at that time you what you call have your own feelings, and it's a overwhelming emotion because you are not able to manage it. That's why you express various emotions. For example, children experience grief very differently, and this grief can be what you call aggravated or increased by other difficulties where the person is this one, like it will be added. For example, already you have got a patient at home, but you yourself get into some accident. Now there will be double issues because you have to manage the patient at home and you have to manage by yourself. Now what you call now it can interfere and it can have a lot of other issues. So a famous psychologist called as Kubler-Ross, okay, he developed stages of grief. What all happens? Everything, what you call, we do all these things even for a small loss. For example, denial. First of all, we don't want to accept that something has happened. This is where usually, what you call, even for at a smaller disaster level, we don't want to accept, we deny it. And then the next question comes anger. Why for me or why for us? Why not for others? Why I should suffer from this? Now you start psychological bargaining. Now let me slowly, what you call, try to adjust what has happened in the reality. Now, while trying to adjust the reality, now there could be little depression might come because you have lost. The person is lost again, repeating back either the property or the lives. So there could be a depression, but later the person has to accept it because okay, the life has to move on, and person now slowly will what you call revert back what you call to accept that what has happened and then move on. So these are the 5 stages of grief given by Kubler-Ross. Basically, denial we don't accept, and we get angry wife of us. Then the bargaining comes, then the depression, and the acceptance. Dr. M.N. Saudagar, for the participants, okay, please mute yourself because it will be disturbing others also. So this is a grief part of it. Then what are the stress reactions whenever some disaster happens? Okay, so we because there are 4 phases of stress reaction. So first one is what you call it can be physical stress and as well as psychological stress. But the stress reaction phases are basically what you call 4 levels. The first one is the acute phase, second one is the reaction phase, third one is the repair phase, and fourth one is the reorientation phase. So this the first itself is the acute phase because something has happened and you are reacting, the stress will be very high. Then you start reacting to it, slightly there could be reduction. Then you start to what you call repair mechanism where you try to what you call manage the situation. Now this is called as repair phase. And lastly, you want to reorient to the entire thing. That means getting back to normalcy. So that space is called as reorientation phase where you slowly trying to come back, but still the stress will be there. So 4 phases of stress usually where the person is experiencing is acute, reaction phase, repair, and reorientation. Now, little I'll go little faster here because we have more slides to cover. When you talk about acute phase, remember it can last for minutes, hours, or days, but person will have what you call either fight or flight mode of reactions. Fight is you face the situation, flight is you get away from the situation. So one of the response of the person would what you call adopt. Then narrowing of focus. That's why I said where what you call affect numbness, where decreases ability to think properly, narrowing the focus. Emotional reaction. Now the person will not believe. Person will have what you call think that what you call everything is lost. The reaction would be very different. Then rigid behavior already we have said irritability, anger, aggression, violence, and sometimes sad, sometimes a cry. All this will affect the what you call affects our communication. But remember, whenever the person is in the acute phase, the person requires immediate attention because if you are not, if disaster management team is not going to take care of what you call the individual at this phase, there could be more damages for the individual. That's the acute phase. The what you call for a person who is suffering from acute phase, there should be immediate attention to manage that. Then comes reaction phase. Now there will be what you call the reaction phase usually like no lasts from 1 to 6 weeks, almost sometimes 1.5 months. Okay, but they'll have delayed reactions like denied feelings may surface. The person still doesn't want to accept. Overwhelming and bringing powerless because there's nothing much to talk about it, particularly to what you call hold about it. So the person thinks that is powerless. Then fear of returning to the site of the event. Person may not what you call have idea of going back to the situation where disaster has happened. Nightmares and other dreams can be there. We talked about anxiety, restless and insomnia, lack of sleep, problem with the muscles and shaking or tremor and exaggerated startle response could be there. We talked about irritability and isolation, depression. Okay. Then there could be what you call disturbing thoughts, like whether to survive or not, relief, guilt, and grief. So all this will happen at the reaction phase. But in the third phase is the repair phase. It may be going to 1 to 6 months. Okay. Now remember the reaction now reduces. It's less intense and not so overwhelming. Now the person is slowly trying to calm down. Feeling of pain would be there and hurt would be there, but person can manage with that. Now, the person might slowly get back to normalcy, having taking up a new job, or start reconstructing the things, start getting back to things. So now the person might slowly getting back. Now the person might think that, okay, what next? Okay, whatever has happened is happened. Now what next? I have to plan. So that's the repair phase. And in the last phase, reorientation phase. Now this will go for 6 months after the event has happened, or the what to call distressing event has happened. And now the stress reactions will reduce because it's going, it's a quite lengthy period. Now it will reduce. Then grief reaction, what you call, now the loss of lives or what you call property is not resolved, but now the person has to accept that something is gone or my dear ones are gone. So acceptance should come. Then all the reactions will slowly what you call diminish or disappear. Uh, Now the person thinks how to live further, and what is required at present. That is more important than what has happened. So these are the four phases, from acute to reaction to repair to reorientation phase. And if somebody assists them at this time, I think the recovery can be much what you call faster. Now, in this slide, I've highlighted what are the reactions when something happens. And all these things, what you call, we already discussed about it. And this PPT will be shared later with you. All these things, what you call, in a single slide, I have shown, like avoiding talking and about and negative mood, as well as sleep issues, as well as bad dreams, as well as loss of interest. All these things will happen in the post-traumatic stress scenario. So that's quite common one. Now, what are the psychological reactions, what you call, to disasters? This is where we are getting more serious about the talk. In the first phase, the reactions would be threat, followed by warning, and next level is the impact. So when we talk about the threat part, the idea here is the person thinks that whatever the disaster part has happened or happening, now this will be considered as a big threat, because once the person starts thinking about the disaster, now the person thinks about estimation of things. Now when a person thinks of estimating the things, that can lead to a big threat, like loss of too many things. That's where the threat can happen, and it can bring warning also. So what kind of warning the person gets, like, no, like when you think of a warning part, the warning can be on a lighter level or it can be on a severe level. Again, depends upon the person who is experiencing that disastrous event, or seen that event, or expecting such things to happen. So the kind of warning the person will get. Then the impact, the effects, already we have talked about it. Okay, because the reactions and the impacts are quite high, which not many people have noticed it. Then it's the first phase, what all these things are happening. Then the second phase, what the person will do. Heroic. This is where we do. We want to survive other, okay, what you call, we want to make them what you call, we want to get into action. We want to what you call be a what you call active volunteer, and we want to what you call save lives, save the structure. So a kind of heroic mood comes in the next phase. We sometimes you call it as honeymoon too. Now when you talk about what you call, when you talk about honeymoon issue, don't think in the other way. Okay, the in the honeymoon phase, it basically help from volunteers or government. Now the survivors get some kind of what you call optimism that people are helping them, and government is also assisting them, and there are volunteers. Now this is the honeymoon phase, we say. Then comes inventory. Now slowly the what you call, slowly the victims of the disasters, they think that whatever is being what you call, whatever is being given by government and all, it's only a temporary what you call a solution, but in the long run they have to plan by themselves. So heroic phase, honeymoon phase, and the inventory what you call reactions would happen in the second level, and in the final phase, disillusionment, reconstruction, and recovery. What is disillusionment? Is like you expect a lot of things from others and lot of what you call help and this one, and you know that because of the bureaucracy and other things, it may not reach the individual who really in need of it. Now the whole scenario changes, and when it changes, the person might get disillusioned. Whatever is expect, whenever you get disillusionment, so whatever you expect when we don't get, we are disillusioned. So in a way, we think that what we think is not happening to us. Now this can lead to disillusionment. Now slowly in the final phase, the person gets into reconstruction. Now the person thinks, says, I have to do myself, or we have to do ourselves to manage our things. So the reconstruction level begins, and at the final level, it's a recovery where, as I said, getting back to the normalcy. So the same thing we have what you call shown through what you call shown through a picture. So it starts with the pre-disaster where you get we talked about threat and warning, and now the impact happens. The person will get into the heroic mood. We are trying to save and all, and then honeymoon where you think that what you call government and others and NGOs are going to help you, but not that help is not what you call is as you thought. So that's the inventory phase. Everything comes down. The emotional what you call lows. You can see on the left side emotional high and emotional low. Especially the emotional high is what you call comes when honeymoon phase, where what you call you think that you are being what you call given a lot of facilities and freebies by the government and this one, but it immediately comes down because of the inventory part that leads to disillusionment. Now the person by himself, you can see after 1 year, the person starts working through grief and the reconstruction and the recovery for a new beginning or for a new life. So now on the left side, you can see again in the reconstruction, the emotional highs goes up. You see there, but it's very low when the person has got a disillusionment because several events would happen. So this is what you call phases of emotional response on a psychological level. Now another few things I need to discuss about with you about what you call what happens what you call whenever the disaster happens. Three of the things one can discuss. Okay, resistance, resilience, and recovery. So what is resistance? We know resistance means to block something. Okay. Now when it says resistance, okay, we try to defend against manifestation of distress. Like something has happened to them, but we don't want to what you call accept so easily. We defend, and something impairment has happened. No, we don't want to this one. We try to resist it, or it could be a dysfunction part of it. The next one is okay. After resistance, the person is resilience. Here, bouncing back or trying to get back, and this getting back could be rapidly and effectively from psychological distress. So some people are good in that. Whatever the trauma happens, they'll immediately bounce back and they want to get into normalcy. But unfortunately, many of the people are not able to bounce back quickly, and that might have leading to more psychological issues and might end up in psychosomatic disorders. And the last part in what you call the recovery part, okay, now regaining the ability to function adaptively as usual, and whenever something is happened, now they're getting ready to it. So in a way to prepare even in advance to the disaster, forthcoming disaster. So the recovery will again what you call add to not only just coming back to normalcy, even might preparing for the future such what you call happenings. Now, how to cope whenever there is some what you call some disaster happens? Now, first thing is ability to orient oneself rapidly. Now, that is nothing but the reality. So, orientation comes. Okay, what exactly happened? Now, this is where one has to orient oneself rapidly. The quicker adjustment and what you call acceptance that what has happened is good coping skill. Now, next level is planning and execution of decisive action. Okay, now whatever happened is happened. What next? That is more important because You cannot what you call go back and reconstruct everything as you think. But what next you can do, because damage has already happened. Now there is no meaning in thinking back, because what you call if you think back again, it brings a lot of nightmares and sleeplessness. So rather than what you call take some action and plan it first, how to do that and execute the action. Then yes, there are enough resources are available. How we are going to use them? Of course, with a lot of other interference with the bureaucracy, with the middlemen, and this one, a lot of aid comes whenever the disaster happens, but many times that aid is not reached to the victims or the needy. So the appropriate use of assistance are also, such resources also important. Then tolerance of uncertainty without resorting to the impulsive action, because when you talk about the uncertainty, you don't know what happens tomorrow, but one need not be impulsive about it. Just wait and calm. Being calm and all can get fetch you a lot. Then whenever there are painful emotions are there, the expression is also important, because you must have seen for sometimes for small things the emotional reactions are very high expressions. Some people with the bigger what you call loss, their emotional what you call expressions could be less. So, but whenever some disaster such happens, appropriate expression of painful emotions also will have their own impact. Now, what are unhealthy? Which is what you call unhealthy? We call which is not good. One is excessive denial and avoidance. Some people even after 6 months still they are not controllable. All the time they think and they don't want to accept it. No, this has not happened. It has not happened. So excessive denial and avoidance is also not a good idea. It is unhealthy coping. That means we are not managing well. Impulsive behavior. Now the aggression or violence can come. The person may be impulsive. No, it's of no use and it's unhealthy coping skills. Then over dependence. All the time what you call depend on others, thinking that you are a big victim of the disaster or the situation. So you expect all the time help from others, either financial help or any other help. You all the time expect to what you call this one. This is not good. How long anybody will help you? Because you need to stand your own, and you have to stand you have to work with yourself first. So over depend is also what you call unhealthy coping mechanism. Then inability to evoke caring feelings from others. See, this is where what do you call persons are not bothered about you. Why? Because your reactions have made them not to bother. For example, over dependence. Even in our normal day-to-day life, nobody likes over dependence, because the more the person is over dependent, you lose, others are going to lose feelings on you. They might start what you call they may disliking you. So this should not happen. Then emotional suppression. Now, in psychology, we say if a person is crying, allow them to cry. Why? Because it gives them a lot of relief. But if you block them, now that pent up what you call emotions are still there inside the person, might blast in some other occasion. So that's why uh, don't try to suppress the emotional issues of a person who is victim of a disaster. Then substance abuse, because this is a common thing where whenever the person is under loss and all, the first thing he thinks of use of substance, and the use becomes abuse. So that is not a what you call a good this one. So substance abuse also can lead to unhealthy coping skills and can add more problems in the future. So that's why unhealthy coping mechanisms skills one should not use much. Then what are the cultural factors which influences our reactions and coping skills? So there are a lot of this one what you call cultural factors. One is nation, our origin, our customs and traditions also matter. How long we lived, that's the length of residency. The language we use, the age and generation, because now we are in beta generation. Earlier it was all this one what you call Gen Z and all. Now what kind of generation and facing them? Gender also matters a lot. Who is going to what you call react more? Then religious and political beliefs also matter, which influence the disaster reactions and or how we cope with them. How the people around you, your family and community have perceived about this. This is also very important. Then health, well-being, disability, physical ability or limitations. Because the more you are healthy, your well-being is good. If you don't have disability, your physical ability is good, then you can manage your what you call disaster issues better. Socioeconomic status also matters a lot. Education level, yes, the more you are educated, the more you know about scientifically know about the management part of it. Yes, you can do that. Then geographic location. Now, why geographic location? Because the place where you live also has impact. The place where you have got minimal resources will put you in more distress. Whereas the place where you can get enough resources or additional resources, you can manage the things better. So that's the idea in what you call cultural factors and all. Then slowly moving on to the intervention part of it. Why early intervention? Now, usually even in the what you call in the general saying is there, prevention is better than cure. The same thing what you call will be used in mental health also. So why? Because uh, if you prevent few things or early intervene, that's better because you can avoid the threats later. The original damages have already happened. Now, what about to the psychological damage to the person? Now, think of what you call reactions part of it. You start with the distressing event, something has happened. You have immediate reactions. So, these immediate reactions, what you call, if some therapy is given, now it will be better so that what you call the person might what you call adjust easily, and which leads to a meaning of event to the person what you call uh, what the person would be telling what you call that is more important for the rest of their lives. So as usual we find okay early intervention is better than later trying to cure. So I'm not going to talk about much about what you call hierarchy of needs. Most of you know about this. How we try to what you call get into self-actualization, where initially we try to satisfy our biological and physiological needs. Then we try to have a safety needs, some what you call residence and all. Then we want to have what you call have some relatives and all. Then comes to the what we want to make some name in the society. But ultimately we want to what you call uh, what you call self-actualize ourselves, where we are trying to understand complete our weaknesses and strengths as well as others. Uh, so we are trying to go for that, which is good. Then once you do that, what are the attributes and skills that suppose you are what you call rescue, you are in the rescue team. Please understand, it looks very what you call very flowery and very interesting to help this what you call victims of the disasters. But what are the basic skills you have to manage them? The first one is good listening skills, because somebody what you call somebody should listen to them. The victims they want to explain so many things to you, and if you are not in the mood to listen, then it cannot be good assist, what you call good counselor or a good person to care them. Patience is required because in counseling and in other resources, patience is the characteristic of a person who tries to assist the what you call the survivors of the what you call the disasters. Then caring attitude, not too much. We call it as sympathy. Okay, you need to what you call show your sympathy towards them, and you should evoke trustworthiness or faith them. Otherwise, they'll not open up, because unless they don't believe you, they'll not open up. So you have to be in such a you have to use such skills that they should be completely trusting you. Then being approachable and culturally sensitive. This is more important. We cannot go by what you call as I would help only this cultured people, only belong to this culture. No, and you should be what you call being approachable. That you should have a pleasant what you call approach. I'm not telling about your face or your beauty. I'm telling the way you approach itself should be pleasant feeling. You should bring warm feeling for the other person. Then only you are approachable. One should not be judgmental. See, this is where one has to be very careful. Why? Because you're not going with a specific community. specific gender or specific religion or specific lingual individuals, because if you do that, then you will be labeled. So one should be non-judgmental being in a rescue team. Then flexible and tolerant of chaos. Yes, whenever you go, what you call, you should be flexible and tolerant. Now, why I'm telling this, because if you're not flexible to adjust to a situation, you cannot manage the things. And you should be tolerant, because the patient's part is very important, because we bound to happen, but you should have what you call such attributes to manage. We'll move on to the psychological first aid. Okay. Now, what is the psychological? We talk about the medical first aid. So there is a concept called as psychological first aid. So usually, what you call, this is a kind of what you call a treatment plan for assisting plan to people who are actually affected by what you call disaster immediately. Now, this particular PFA or psychological first aid is designed to reduce the initial distress, because they will be having an initial phase of reaction, acute phase. Remember, go back to the acute phase. Now, especially for children, adults and families, they'll be really lost. For them, psychological first aid is required, and you will not wait. Okay, today we'll do, tomorrow we'll do, day after we'll do. No, we'll do after 1 week. No such things. It should begin immediately following the disaster. Whenever the disaster happens, because the person has witnessed it, now it should follow immediately. So first aid begins there. And what are the core principles in the first stage? First aid. One is the contact and engagement. Now you should immediately contact the person or who has been allotted to you and engage the person immediately. Safety and comfort are also important. Now, because already the zones are little what you call we say quite what you call proneness to furthermore disaster or this one. So safety and comfort also very important. Stabilization, because there is a lot of mood ups and downs. There is a cry, there is a anger, there is what you call variation in the emotional sentiments. So need to stabilize. Then gathering what you call information, because sometimes what happens, more of misinformation what you call will be there. So this misinformation can mislead the people, and it can bring more what you call psychological distress in the person. Then practical assistance is also important, because you are not just telling from your mouth that I'll help you out. Actually, you have to really help them out. Practically, you have to assist. You have to take them, or this one you have to bring to this one. All that things can be done through practically. Then connection with the social supports. So when you say connection with the social support, basically you are going to bring NGOs and others to bring the person, to help the person, so that the person thinks that he is not alone, is there is a support group is available, and the support group can do a lot. And the connecting between support group and the victim, that is a job of a psychological first aid person. Then information on coping. Now, it's not only information on the event, information on coping step by step, how the person can cope with the such disaster. Then, as usual, linkage with the collaborative services, because depending upon the severity, the person, whether person requires on the spot counseling or the person requires counseling with the special experts. So that also can be done. So all these things will be what you call core principles which happen in the psychological first aid. Then, if you are what you call part of what you call psychological first aid, so what all you can do? The first thing is you need to promote. These are the 5 things. One is promoting safety, because now they are so much in what you call uh, fear and phobic reactions they have. A psychological safety, you have to bring them by bringing assurance and confidence. These 2 things are important. The safety, you're not just putting in a room or something. Psychologically assure them, psychologically bring them a lot of confidence. This one is what you call confidence. This can bring a lot of safety, what you call uh, mentality for the victim. Then being calm, promoting calmness is very important, because you know that the person who is suffering from this disaster issue must be what you call calmed down, So you need various techniques. Then, as usual, we talked about connectedness because sometimes what happens because of the disaster, there will be totally what's called dealing from the people, dealing from many of the important connections. It could be people or it could be even what you call the technology. Now, promoting connectedness and trying to connect to the what you call relatives and others who are in a safety zone can make a better life. Then self-efficacy. Now, where your counseling can help the victim to identify the self-efficacy, that person can bounce back. So that also important. Then help promoting help also, where I don't know to explain much on that. So as what you call as a person in the team, you can promote help also. So these are the 5 factors. Then please remember what you should not do. Now, why I say this? What you should not do. Sometimes people expect to tell everything and expect to explain again and again. Please don't do it because it's again what you call you're taking back to the person to the flashback, and flashback can bring a lot of nightmares. Okay, and don't simply assure that everything will be okay. Who are you to tell? You say let us try to correct it. Many times what happens, we just know everything will be done. Okay, government gives everything. Okay, we are there, but are you going to do that? So that leads to what you call inventory. Remember what we have done, disillusionment. So do not give simple reassurances like everything will be okay. No, everything will be okay unless you also join hands with me. Then do not tell people why you think they have suffered, because sometimes what we say, okay, you are done by bad deeds in your future life because of your bad deeds. So this is happening to you. No, please don't tell that. Okay, what you think that why they are suffering. You may have several ideas. Or in your previous life, you have done something wrong. Now it's happening to you. No, we don't know why it has happened. There could be technical reasons. So that we have to discuss rather than whatever is in our mind, we should not tell. And do not make any promises that you cannot keep. If you make a promise, you try to maintain it. Otherwise, don't make a promise. Then sometimes there are some people have what you call very bad habit. What is that bad habit is? Whatever the services are given by government or NGOs, now these people start criticizing, and by criticizing, you what you call demorale the person who are helping, and that help also may not come in the future. So don't try to criticize the services or the help rendered by others where the victims are in front of you. You cannot blame these agencies or the government or the NGOs or who are trying to help these people, because this will give a very bad reputation, and next time those agencies may not come, and the people victims might consider them as enemies. So these are the things you are not supposed to do. Then sometimes there are intense emotions you can see among the victims. So how to manage them? The first thing is the communication should go calmly. That's why go back to our principles, patience. You have to communicate things very in a very what you call calm way. You should not be get what you call emotional. That's why I don't use the word empathy. I just use the word sympathy. There should be sympathy, but use empathy at a very minimal level. Then communicate warmth. What do you mean by communicate warmth? They should get a feeling that you are really with them. It is not like you are an outsider. So you are gone as a what you call psychological first aid worker. Now you can communicate warmth. Establish a good relationship. The what you call faith and trust would match here. So you should able to try to establish a good relationship between you and the victims. Then now there is no what you call beating around the bush. It is directly concrete questions to help the person to focus. Because what next you want to do? Concrete question. You cannot think of going back. Okay, this shouldn't have happened. Do you think anything would have happened? No, no such questions. What next you want to do? Do you need some assistance? So all these concrete questions. Now come to agreement about something. That's also more important. Now you have to make what you call the victim to come with the agreement with something. Now, lost is lost. What next? Because rather than thinking about the past, the communicator or the first aid worker should say how to plan for the future or what next, and speak to the person with respect, because the person is already distressed. You cannot treat them at the third level or fourth grade, the third grade or fourth grade level. Now you have to really give them respect, understand their psychology, lost lives, lost properties. Now they need with some respect, treat them with respect. Then you have what you call seek immediate assistance. Okay, if person becomes threatening or does not respond, this also happens uh, when we say the person is when emotionally what you call struck, the person is in what you call out of orientation, person may not even what you call responding to you, then you cannot sit back. The only thing is immediately report to the higher authorities or ask others to assist, so that you can avoid another damage or another big what you call disaster. Because sometimes what happens, they are not able to communicate to you. They are in such a worse position that they are not able to tell anything. So better immediately inform to the higher authorities. So then the another part is the referral part. You know all this referral part where how the people are going to refer. Okay. So when I am not able to handle the things better, so I usually refer to the next person. But this refer should be on a what you call level that the person should able to what you call manage the things better than me. Now that's what happens usually referral services. Usually you go to doctor in the normal conditions and the doctor might say I am not a right person for this. You might refer for this person. Same concept here. Okay, making referrals when you are not able to manage well, better you refer that case to the next person who is going, who are having higher expertise on that. So there is a big list of it. Okay, uh, what kind of people what you call require referrals? Suppose a person talks or gives a hint about committing suicide or suicidal ideation, they require a referral. Okay. If there is a possibility of child abuse or criminal activity, there they require referral. Social isolation is another issue. Then person who is what you call having imaginary ideas or feelings of persecution. So this is basically we get into the psychological part, psychopathological part. Imaginary ideas or feelings of persecution, we usually refer to as delusions or hallucinations. So such people really require higher referrals. Suppose I don't have what you call enough training or capability to do things, so then it's better to go for a referral. Okay. Suppose a person who is what you call connecting to you is in a risky or threatening behavior, sometimes it will be a risk for your life itself. Better not to interact. You go for a referral. Then please understand, people who talk about suicide are the ones who ultimately commit suicide, because if the idea comes to them again and again, that means they are in the idea of committing suicide. They require definitely a serious counseling. They require definitely a better referral. So refer them. Then there could be some minor threats or there could be some severe threats. So take them seriously, because all threats are serious, and you have to immediately contact your what you call supervisor or the person in charge around you, so that at least you can save this life also. So this is how you can what you call refer people in what you call various ways. But while referring and doing all these things in psychology, we talk about ethics and morals. So what are these ethics and morals? Is nothing but maintaining the confidentiality. Because whenever you help a person, which builds a trust and respect, you have to maintain a confidentiality. Whatever you discuss, you should discuss in private and maintain confidentiality. And at any cost, what you call personal information should not be discussed without consent. So that's the core principles of counseling, where because why this is required, because the person has a trust in you, he has lot of faith in you, and he believes that your problems will be solved if he or she can discuss with you. It could be at a very private level, but you should not disclose this outside because it might ethically it is wrong. So, except in few of the conditions where in emergency, where when it's what you call harm to the person himself or when it damages the national interest, in such cases, yes, you can report to the others. Otherwise, you have to maintain the confidentiality. So this is where what you call I'm going to stop now. So we have another 3 to 4 minutes. So if there are any quick questions, you can ask. Now the session is open for discussion. And this PPT will be shared later. Nanjenda Swami sir will share you in the group. But any clarifications or any doubts? I see only few people on the screen. Dr. Saya sir, any clarifications? I'm seeing you on the screen.
No, sir.
Shashkala madam, unmute yourself, madam.
No, sir, understood.
Okay. Rajana sir.
So I have a question, sir. I'm Murshad, 89, sir.
Okay, okay. Mushad Raman team. Okay, tell me, sir.
Yes, sir. Yes, sir. Sir, you have given an in-depth like an understanding about the consequences of a disaster, especially with regard to the emotional and psychological. But as a individual, sir, or maybe as a teachers, how we need to sensitize our students, because certain emotional responses or emotional impact will be in long term, especially including PTSD and all. So what like what kind of emotional response we need to take during the disaster, especially like on the onset of disaster, or maybe like 1 hour 2 day after the disaster happened.
You want to know about how to sensitize our students?
Yes, sir. Yes, sir.
Okay.
How immediate response, what kind of
Okay. Now, one thing is, I don't know whether your university offers a disaster management course.
Yes, sir, we are offering that is.
But is there any psychological management or psychological first aid?
No, it is general only, sir. With disaster, what is types of disaster, all those things.
Okay, good. That's a very general one. Now you understand why this talk was added. Earlier in the disaster management, psychological aspects are totally left out. Because of the psychological impact is so much that even till some of the individuals who are not recovered, even till even this one, till death, they were what you call continuously they were suffering.
Yes, sir.
Now this is where we have to sensitize our students. Now how to sensitize? The first thing is we have to say what are the what you call severity of the disaster and what kind of response could emerge from the what you call target victims. Okay, because not everybody is a target, because uh, the idea is about the target victims are nothing but who are going to suffer from them and study their psychology. Now this is where we talked about acute phase. Now because it's all based on the stress tolerance. My stress tolerance and your stress tolerance will be very different, because our stress tolerance capacity would vary from individual to individual. Now first you have to sensitize the student in such a way that identify possible disasters type. This is what we are talking about, the prevention part of it. Identify and make them mentally prepared or psychologically prepared to face them. Are you getting my point?
Yes, sir. Yes, sir.
Because we can see, suppose I don't know whether you're from which state.
Sir, I'm from Kerala, but I'm
Okay, Kerala, very good. Okay, now you know the Wayanad issue.
Yes, sir.
Now Wayanad issue, some few of the villages are vanished and all.
Yes, sir.
Now those people cannot leave their place and go down in Calicut and they can live there.
Yes, sir.
They cannot leave the place. Remember, they have
Correct.
to stay back. They have to continue their life. Now identify these issues first. Sensitize first. You have to sensitize the students, like how to manage the things within the limits. where your human resource management also will be useful here.
Yes, sir. Sir, because I'm also a social work educator.
Yeah.
From 2018 onwards, during the flood and after all the disaster,
Hmm.
with NIMHANS, like I'm active member, especially joining hands with some of the NGOs, immediately like we will provide some psychosocial support and all. So
Okay.
my experience, what I understood is that whoever the volunteers are coming, the initial, that is what important, sir. The initially how they need to understand the situation and put forward, because
See, initial first thing itself is they have to be calmed down,
yeah,
because without calming down, nothing happens.
yes sir,
They are in a very high acute phase. Remember.
yes sir,
So that's why we said in the acute phase, they really requires a big attention.
sure sir, sure sir.
And that time, believe it or not, even your talk will not work.
Yeah,
Huh?
yes sir,
You have to really in such a way that they should be like, no, you should be in such a way that they should completely trust you. But you
yes,
cannot promise them that we'll do everything.
yeah,
Then you will be caught.
yes, yes sir.
And another problem with our volunteers is first few days they'll be very serious in what you call doing things.
Hmm.
But after a few days, now they want to get back to their places.
Hmm. Exactly.
I think you must have experienced this.
Yes sir, exactly.
That the first hype, no, that okay, I'm going to help them out, heroic.
Hmm.
But that heroicness will come only for 1 or 2 days. Then when you understand the ground reality, now
Yes,
they want to run back to their places.
yes sir.
So first thing is two things. One is making these people to what you call accept things.
Hmm.
The victims, they have to accept. Because remember, first the denial comes, they don't want to accept, then comes anger. Huh?
Yes sir.
So these are the phases where you have to work out systematically.
Yes, sir, I
And we,
agree with you, sir, because recently one of my junior has defended his thesis on this particular topic only,
okay,
volunteerism during the disaster time. So in that study also, the major thing they have come out is that as the volunteerism is coming with them only for the kind of a rescuing and rescuing only, not they are much focusing on rehabilitation or maybe long-term volunteerism.
yeah,
They just want to meet the requirements which is required because more
they
man
build
is
they build
required.
some constructions and they think okay, this is our job and they
Yes.
go back. Huh?
So we need to focus on such volunteers and we need to sensitize them and what actually is required for the victims of
No, no,
disasters.
no, Raman sir, I want to tell you one thing.
Yes, sir.
First of all, sensitize the students how we are destroying our environment.
Yeah, yeah, correct.
Huh? See, this is where the beginning of the what you call avoiding of these disasters.
Yes,
Now
yes.
the same thing happened few years back in Coorg. Same thing, resorts and all. Cut the
Hmm.
trees and there is no grip for the soil. Okay, entire hillock comes down and sits over another village. Huh?
Hmm. Yes,
So
sir.
same thing. So sensitize our students first, like why disasters are happening
Yes, sir. Exactly.
and how we can prevent them first.
Yes.
Sometimes it is what you call. Sometimes things are not in our hand.
Hmm.
That's a different story.
Yeah.
So at least we can manage the things which within our hands. So
Yes.
that is why it's not only just students. It's even the policy makers have to plan in such a way that stringent rules.
Yeah.
But the big question is who will tie the belt to the cat? Hmm?
Thank you, sir. Thank you so
Huh?
much.
Okay, okay. So more questions?